Welcome to Treating TMJ, a journey to a pain-free life.
Welcome to our podcast. And really, as a patient of the TMJ and Sleep Center, you've hit on it before with me, and the word that'll keep coming up through every episode is journey. This really is a journey. But the first step of that journey is understanding what you're going through and if TMJ and the work that you guys do is the solution to that problem.
Correct. We do a cure consult, which is at no charge. And what I do at that appointment is I explain to the patient or the prospective patient what TMJ is about, what we do here to cure it, and if this is something they're interested in, and I'll give them examples of. I have all kinds of models before and after. I've got literally thousands of models, befores and afters, and X-rays and stuff, which will prove what I'm talking about. And so if the patient, and the other thing is I want them to get comfortable. And the other thing, quite frankly, is I want to be able to know my patient, because this is you don't want to be half-hearted into this. And so you want to accept the treatment and understand that you want to embrace it because you have to be consistent. And I'll even tell these 6, 7-year-olds here, and we get really good patients because at age 5, we can avert, adult problems and let them grow properly when we have the jaw in the right place, the muscles in the right place, the airway is in the right place, so they're getting the oxygen they need to develop properly and be good in school and grow properly. So all these things are whole body concepts that we try to explain to the patient. And so that's like the first bit. That's like if think of a stairway and we just took the first step. Right. Small one is the first step. The second step would be a TMJ exam, which is at least an hour in length, and we palpate about 40 different muscles, and we will do tomography of each joint. A tomography is a special X-ray of the jaw joint, which will give us the position of the lower jaw to the socket of the skull. And that position is important because when it's too far up and too far back in the skull, it's not the right place, okay? And that position is dictated by teeth. So when a kid or, in the beginning starts to put their teeth together and that jaw is stuck up there, the ramifications to these muscles, this kind of becomes obvious if you think about it 5,000 times a day, because these muscles are going to get shorter, and as they get shorter, and they're not happy, but guess what? You've been with these muscles forever, so you might not necessarily notice that because it's over time. So it's a slow degenerative process over time. But what muscle does when it's not happy is it changes bone. So how does muscle change bone? Well, if it's not happy, it's going to put spurs on the bone, which spurring, when you see a spur on the X-ray, you've got osteoarthritis. Or you might have disc herniations, things like that where the muscles are just doing their thing because nothing's being done to alleviate the problem of this jaw, where the jaw is set to the skull. So, and I know it's a hard concept to understand that a jaw can affect your back, but the muscles of the jaw go into the neck, shoulders, back, and especially the first rib, which dictate breathing. And so the more your head becomes forward, the more you don't, I'm going to go a little segue here, the more you don't breathe properly, you breathe upper chest, not lower abdomen. And when you don't breathe lower abdomen, and you breathe upper chest, you get a 30% reduction in oxygen, but you're also affecting the spine, not just the neck, but the whole spine as well. And you're breathing a lot, obviously. You got to breathe. A lot of times I'll ask people, so what's the most important thing you can put in your body? I can't believe they say water sometimes, but they do. But it is air. And and the body will do anything to create an airway. And when muscles aren't happy and the airway starts collapsing, the body gets contorted to create an airway. And that's a lot of times that's why you've got, one shoulder higher and one shoulder's ahead of the other. And in my son especially, he had an airway problem. And boy, I'll tell you, and at age 6, you could see the disfiguring in his posture, but we caught it in time and we changed it and he grew properly. And so all was okay. But you want to be able to see these things. But here's the other thing I need to say though. It is genetic. It is in families. It's not an isolated case. If you have it, likely your siblings have it. Your mother and father, one of them has it. And things that you wouldn't count on being TMJ. They might not complain about their jaw, but they might have neck pain because forward head. They might have back pain. Again, when the head's forward, it can weigh as much as 40 pounds. These are figures I didn't make up. I can give you the resources to this. But if you're carrying a 40-pound head for 30 or 40 years, what do you think that's going to do to your spine? So
and your knees
and your exactly. And this is when they tell you, and they're not looking at forward head, but they'll tell you, well, you have your hip's hurting because you have arthritis in your hip, or your knee's hurting, arthritis in your hip. Now you need a new knee or new hip. The problem is you didn't get rid of the forward head. Now, again, I didn't make this up. March of 2000, the Mayo Clinic newsletter said that forward head posture creates everything we're talking about. As a matter of fact, we can quote this from an article. It's called The 42-Pound Head. You want to Google it, you may, obviously.
If people are curious as to whether they need to go to the TMJ and Sleep Center, that's a great thing to watch to educate themselves.
Yeah.
You turned me on to that.
Yeah, and it's really interesting because that was 21 years ago, and that was 19 years after I first heard my lecture regarding this. Okay, and yet I don't see that diagnosis in my office. As a matter of fact, I've never seen it, but we do. They have it. You can't have TMJ without forward head.
Right.
That's a commandment.
Well, when I went in for my first session just to see if I had the symptoms and things like that, the thing that caught my eye on the website was sleep disorder dentistry. I had the CPAP. I have all of the bells and whistles to try to alleviate the symptoms.
Correct.
Not solve the problem. And about 5 minutes in with you, you started to predict all sorts of stuff that I never associated with what was going on. You're like, oh, I bet your jaw hurts over here. I bet you bite the inside of your lip. Your one shoulder is going to be higher than the other. And a lot of the symptoms you've already hit on were right there.
Right.
And those are the things that people listening to the podcast, like, are you constantly, every once in a while, you didn't forget how to chew. There's a reason you're biting the inside of your cheek.
Correct.
Right?
Right. And even like I'll have them stick their tongue out and say, well, we're going to take a look at your scalloped tongue. And they're like, what are you talking about? And actually the outer borders of the tongue have ridges on them. And the ridges are the imprints of your teeth because the tongue needs some recruitment to swallow properly because the densest, strongest muscle in your jaw and body, the masseter, isn't working properly because it's too short. And when it's too short, it doesn't recruit and give the tongue what it needs and the throat what it needs to recruit for swallowing, for airway, for everything you could think of. And so you get a tremendous muscle imbalance through the face, which can give you pressure behind the eyes and headaches and such on the sides of your head, temporalis headaches, because it's all muscle imbalance.
When you talk about, you mentioned using your jaw 5,000 times a day. That's probably average. Some people may even use it a lot more than that. And then everything that's around
if they're DJs.
Maybe right. Somebody mouthy like me that runs his mouth all the time. But your ears, your eyes, sinus, neck, shoulders, the stuff, spine, everything that's right there, if that one spot is not working right in the sheer amount of use, you can see where it becomes the root cause of the problem. Yeah,
because in the internal musculature, well, actually, let's back up. What I did, and my office manager she didn't like this idea, but I brought it anyway, and I think I don't have it with me. I had 2 toilet tissue tubes, okay, empty ones, of course, and one is nice and round, and the other one is puckered. Now, on the inside of the pucker, it shows what forward head does because it'll collapse the back of the what you have an airway, and the outer aspect is puckered inward because the tongue is going crazy, and so are all the muscles of the jaw because they're in the wrong place, and that collapses the anterior part of the airway. So you have a puckered air tube and you have a normal air tube. Which one do you want? It's kind of like the analogy is: do you want to breathe through a garden hose? Or you don't want to breathe through a straw. Where do you want to breathe? And when you're breathing through a straw, that's not so great. So I have a story, if you don't mind.
No, okay. Not at all.
I had a couple come into my office from Portage, and let's just say his name was Marvin. That's all I could tell you. Anyway, so he came in, and his wife followed, and they were amusing because when I asked, why are you here, the wife wife answered, not Marvin. And so she said, Marvin can't get off the couch, accusingly. And, of course, Marvin glared at her. Then he glared at me, and he said, Doc, I've had this CPAP for 6 years, and I still feel like crap. That's exactly what he said. And I was like, okay, but I watched Marvin walk in, and he walked with a shuffle and a forward head posture, and he was in his upper 60s, early 70s, or something to that extent. And so that 40-pound head is certainly there and robbing him and his muscles of energy. I mean, he's getting air. Don't get me wrong. You need the air. It's just that that's not the source of why he had the problem. So, yeah, keep the air. I wasn't going to tell him not to use the CPAP, but I was going to tell him about the TMJ problem because you can't have sleep apnea without having the stuff we talked about. TMJ and sleep apnea go hand in hand, and that's about 35 years worth of records that I could tell you. Anyway, so I explained to Marvin, and he decided to undergo TMJ therapy, and 4 months into therapy, the wife was smiling, and Marvin walks in. He looked a little better, and the wife said, Marvin feels better, and he's back to woodworking. He made me a cabinet. And I was like, whoa.
Wow.
I said, that's pretty darn good. So, and we continued with the therapy. And at the end, he was all set, and he didn't have the problems he came in with, which, let's put it that way. And she had a honey-do list to beat them all. But anyway, but she said, Marvin painted the garage ceiling, and we didn't have to go to the doctor for neck injections because the posture was cleaned up. Everything was cleaned up. And I was like, even on a good day, I wouldn't be painting the garage ceiling. So I don't know where that came from. But it was kind of cool because the couple, the interchange.
I have this vision that their garage ceiling looks like the Sistine Chapel now.
Yeah, right? I am like, no way I wouldn't do that even if my neck was feeling great, would I do that? But anyway.
Something you hit on, though, you said neck injections, right?
Right.
And that's one of the things that has been something that I've learned through the process of working with you is so much stuff that people have done is to treat the symptoms,
correct,
not address the problem.
Correct.
And what I like about what I'm going through on my journey with you is we're addressing the problem.
Correct. Yeah. The symptomology, well, that's what you see. That's what I see in my office all the time. But that's why people are there, because they're not attacking the source. And this is not rocket science. It's muscle. That's all I can tell you. And if you think about it, if you're look at what your head over your spine weighs 12 to 15 pounds. The more it comes forward, again, this isn't me saying this, but I embrace it because it's true. The more it comes forward, the more it weighs. The more it weighs, the more problems you have with breathing, with posture, with everything. And now take a 5-year-old and go 60 years into the future, and that's not going to be very pretty because you will have a lot of symptomology, sciatica, your lower back, your neck. Again, possible sleep apnea, possible vertigo. Vertigo is a big deal with TMJ, and it's connected and I can tell you for a fact I had it, and I was in the ER with it about 30 years ago, and I thought, and as I was treating TMJ, I knew I had it, and I was sort of treating myself, but not the way I wanted to, but I put it off. Because I was running marathons, I was into working out, and I was like, okay, I've got some neck pain, a little back pain, I can deal with it. Until I tried to get out of bed one morning and couldn't because the room wouldn't stop spinning.
See, my dad was a mechanic, and our car never worked.
There you go.
So that's what you had going on there.
Oh, my God. And I got driven to the hospital. I had a garbage bag in case of throwing up. And when I went there, I told the ER people what it was, and they left, and they said, it can't be TMJ, it's got to be cardiovascular. I said, I'm running marathons, it's not cardiovascular. And they came back and said, you're right, it's not. But I don't know if they truly believed it was TMJ. But they gave me some meds so I could get upright, but it made you feel very drugged. And then I started in earnest treating myself, and I never looked back because I got rid of it. But it is devastating, and you don't want to get that kind of stuff. God forbid I was in a car when that attack would have happened, and I don't know. I don't know how anybody could drive. You can't.
Well, when I came in for my consultation, I thought I had 2 or 3 symptoms. And one of the things that fascinated me, it was there for about 5 minutes, and I figured out, or you predicted, that I had about 10 or 15 symptoms.
I don't numerically number them, but you can't be the age you are and not have certain things happening, particularly since forward head has been there. And that's what I'm going to tell you. When you leave forward head in position for 30 years or 40 years or whatever it is, you have to have certain symptoms. And I had an engineering patient in, and I showed him what the forward head position and what it does to the posture. And he said, well, that's just an engineering deal. I mean, look at what you're looking at, because it's an anchor. Your head is an anchor. The body has to follow that anchor. Well, unless you get that anchor over the spine, you can predict these things are going to happen. As a matter of fact, if I could segue it for a minute, I had a little girl that unfortunately just had braces off and she couldn't open her mouth, which is why they referred her over. She opened only 19 millimeters, and the normal for TMJ is 45, 55. And here's this 13-year-old kid. So I'm looking at her, and the mom walks by, and I told the little girl, I said, geez, in 27 years, you might be your mom. And the mom is 40. And she looks at me and says, what are you talking about? So I was like, well, I better tell her. So I said, well, I watched you walk in, and you have a pretty good forward head posture. And I realized that you're 40, so certain things are in place: neck pain, back pain, disc herniations, spinal stenosis, which is the narrowing the blood vessels to the lower back because of this head weighing so much, and possibly reflux, because when you're forward, you don't digest quite so well. And I just hung it out there. And so she just looked at me and she said, I have all of that. I just had a disc removed, and they just told me I have spinal stenosis. So make of it what you will. It's just common sense. I'm not a rocket science, believe me, at all. It's just common sense. If you have malfunction and dysfunction over years, and your head is the instrument of, unfortunately, paying the price, bringing the head forward, and the body pays the price for the forward head, and that's how it pays the price.
And that really is what happened with me. Like I never associated biting the inside of my lip. You said, I bet you bite the inside of your lip.
Yeah.
And I'm like, yeah, I do. Yeah. And in my last meeting, what was that, last Wednesday, I had to follow up with you. And I'm like, this is the first time I've come here and didn't have one of those spots where I'm biting my lip.
Yep.
And I was like, seems nice. Because I used to get mad at myself. I'm like, what'd you do? All of a sudden forget to chew, Randy? Because then your inside of your mouth is going to hurt for a week until it heals.
It's like I said, with this muscle disease, a lot of times the patients will come in, and it's a very common theme. They'll say, my bite doesn't have a home. And that's exactly what they say. That. And I was like, wow, I always remember some good stuff like that. Your bite doesn't have a home. Well, how can it? Because the muscles are continually evolving in a bad way, because you're not changing anything. When your teeth come together, bad things happen because the muscles are too short. So because they're too short and they're dysfunctioning and they're tight, they're going to create changes on your teeth and changes in your bone, and that's not fun to over time, of course.
We're talking with Dr. Insulara from the TMJ and Sleep Center about the symptoms that may be the signs that you need to come into the TMJ and Sleep Center and talk with Dr. Insulara. So you did the A-B comparison there. You've talked about the 13-year-old and her mother, and you've also hit on that it's genetic. And one of the things that goes along with you is your passion for knowledge, and something you've done a lot of is studying nursing homes and older people, and then I guess the best way to say it is kind of reverse engineering that.
Well, I went to them as through a healthcare system, but had nothing to do with TMJ. It was just that was something I did on Fridays and Saturdays. I worked at TMJ Center Monday through Thursday. So this was just, some additional income, making sure the patients were, doing what you're doing, cataloging them in and doing what you can do within the scope of a nursing home. Anyway, but what I realized when I started it was, oh my goodness, here are my virtual TMJ patients years later, and this is what forward head posture can give you, unfortunately, and it's not pleasant because these people are either in walkers or wheelchairs, and that spinal stenosis that we talked about will not let you get up out of a chair with any degree of ease, and it might not let you get out of a chair at all. So, but prior to that, I also noticed that there was some new knees and hips, and the physical therapy was evolving around the new knees and hips, but nothing was done for the contributory of the problem with the head.
Going back to the you're treating the symptoms, not the problem.
Yeah, because they're not aware, and that's and I don't know. I'm not blaming anybody or faulting anybody. I'm just saying this is what I saw in my in the 9 years. Look, I spent 9 years in these nursing homes. I don't do that anymore, but I spent 9 years and possibly 500 nursing homes. So it was all over the state. So, but it was all the same stuff, and so you could literally take a conclusion and say, if you have a 5-year-old with, decided forward head posture, you could, if you don't change it in 60 years, you've got what you're looking at. But nobody makes the connection, and that's. I guess I was just shown it. I mean, I didn't do that on purpose. It just hits you right square between the eyes, and you can't avoid it. That's the connection I got.
And when you and I were talking about the genetic tie-in, one of the things you asked me was if my kids had to have tubes in their ears.
Oh yeah, that's
and I
a good
said,
one.
Yeah, they did.
Yeah,
That's why I'm like, has this guy got cameras in my home?
Well, unfortunately, the tube thing. Okay, if a family is inclined to have TMJ, the back of the joint has a fissure. It's called the petrotympanic fissure. And through that fissure it's got a ligament, Pinto's ligament. Not that you need to know that, but it comes into the middle ear. So there's a connection. Just know that there's a connection from the jaw to the middle ear. And like any joint, a jaw has a covering over it with lubrication fluid to allow you to, work the jaw properly. But literally, if the jaw's too far up and back, like we discussed, and you're continually clenching, grinding, or doing whatever you're doing with your teeth, you can literally push joint fluid into the middle ear. That's exactly what it is. And here's why I know. Because when we open the bite up via either some temporary little baby fillings on these kids or put an appliance in on these kids, which opens the bite by raising the bite, and the jaw comes down and forward, so it's not pressing against the ear, you effectively don't have any fluid anymore. And I've done that actually with adults who have had that problem, and they have, and we've gotten rid of it. But it's never diagnosed. It's not even, I don't know if they effectively, they couldn't. They don't measure the fluid, so they don't know what it is. But my point is, if we can get rid of that fluid, then you don't need tubes and you don't need antibiotics. And
again, it's the reoccurring theme for this episode, but getting to the root problem instead of addressing the symptoms.
Yeah, I mean, particularly if your children have no fever or congestion, then and this is just coming out of the blue, and then I can. And they have a deep bite, and that's the other thing is what you need to tell. And in your family, if you have a history of TMJ, my family, total history of TMJ. My brothers have it. My father had it. My aunt had it. My grandma had it. Everyone, but I didn't know it at the time. But looking back, I could see exactly the symptomology that I'm talking about.
And that all becomes part of the case study of the symptoms.
Yeah, I mean, it doesn't change. This is like I mean it. It's pretty simplistic. Pretty much no adult should be suffering from TMJ if you catch this as a kid. And what are you catching? Well, like I try to explain to people, deep bites, overbites, underbites, cross bites. Those are all symptomologies that'll send the jaw to the wrong place. How do I know that? Because I measure that. We do tomography. Those are x-rays that are specific for joints. So I can measure those joints, and I can measure befores and afters, and I can measure the muscles. So everything we do is measure. I wouldn't be treating anybody unless I could measure them and unless I can document everything I do. So we don't work with opinion ever.
And that became apparent really quickly to me. It's like there is. You can only do this. You only have this range. You can only open your mouth this much. You can only do this, and you should be able to do this.
Right.
And so there's an A/B comparison.
Right.
And then you're like, okay. Then you start going through the treatments, and you can see yourself moving towards where you're supposed to be.
Which is why when people come in, every time they come in, we see them generally once a month, and they fill out a progress report. And the progress report is, what are you doing for posture? What's your pain levels on all different sites? And we'll be checking those out. What's your range of motion of opening and closing? it's remarkable that, well, I mean, you see all kinds of variations. We've had people open as little as 10, and we've had people open by the time we're done 55, 60. And that's not unusual.
And also the difference in how it opens.
Correct.
Right?
You're
Like, it used to
right.
be like, okay, he wants me to open my jaws as far as I can, but
You're
I
absolutely
usually
right.
avoid doing that because it hurts.
and you can see that on the scans on the computer. So if I tell you that the muscle is dysfunctional, I can show you what dysfunctional muscle looks like, and it's really not pretty on the computer because this muscle is not smooth. The open and closing patterns are not superimposed over one another. They're like, it's like going over a speed bump at 20 miles an hour because there's adhesions in these muscles because they've been backed up so much. So they don't open smooth. They can't open smooth. And quite frankly, sometimes the person that's opening is opening slower because they're expecting pain. So they
Right.
don't open quite so quickly either.
In my x-ray in particular, do you remember that calcification that I had?
Right.
And-
Right. So there's other things. And it has to do with this hyoid bone, which we should get. It would be good to get into. But the hyoid bone is like I said, it's a bone suspended in your throat that's connected to 20 different muscles. 2 of the muscles are from the head. And so when the hyoid is functioning properly and your head's where it should be, then the position of that hyoid is good. It's not infringing on airway. It's not infringing on anything. It's just moving properly. As when things back up and everything is dysfunctioning and the head is forward, that hyoid changes position, and we can see it. I mean, there's an optimum position for it that we can document as well.
No, and as you start to use your jaw improperly and things like that,
Yep.
some other things that start to roll in, like inflammation and stuff like that only
goes
compounds the problem
Well,
if you're not getting it treated.
Right. The because what happens is when the muscle is short, you accumulate inflammatory products in the muscle because you're working these muscles. They would say anaerobically. So you have lactic acid hotspots that we palpate, and you might not even know you had them until we palpate them because they're called latent trigger points, and we know the places because they're all the same with everybody. We're not reinventing the wheel here. This is a tried and true deal, and it even goes back further. There was a lady, Janet Travell, myofascial pain and trigger points. She's an MD, and she was an MD to some of the presidents, and she had that book out, and it's kind of like the Bible for everybody to follow. So, I mean, there's a lot of references to what I'm talking about. Again, you stand on the shoulders of giants to get to where you are now. It just so happens that it's 40 years from where I first started, and some of those people are unfortunately not around anymore. But I am. So
My father had a saying the whole time I was growing up. He always used to tell me I had to be active in my own rescue, and
I love that.
Yeah, it's, he's like, well, this is this is happening to me, this happened to me, this happened to me, and he's like, well, what are you doing about it? And
I
so
like that.
one of the things that I get reminded a lot when I'm working with you from the first meeting was, well, you got to do the work.
Right.
Like we talked about
Right.
physical therapy, and
Right.
I've got my back rolling exercises and my neck exercises, and I think that becomes part of the journey in that you feel like you're active in it, like you have your homework and you're working on it.
Yeah, you have to be. Right up front, again, I always explain this. We don't do meds. We don't do needles. We don't do surgeries. That's all. It's just not needed. If you're doing the proper exercises and if your jaw's aligned properly which I didn't get into, when we do our computer measure of the jaw, we provide an orthotic. It's called a neuromuscular orthotic. Short, I call it NMO. Did a paper on it. I've got plenty of writing on all this stuff. But the NMO that's put into your mouth, it's on the lower jaw. Here's the deal with it. It's because people will want to know, well, is it visible? It's clear plastic, but it's designed via your muscles. So it's not a splint. Okay, this is a dynamic appliance in that it is changing your jaw position three-dimensionally via muscle readings, cross-indexed to tomography X-ray. So this isn't anything to It's not a splint, which is generic, and a splint is worn at night only, so it is static. Dynamic means this is a 24/7 deal. You wear it 24/7, including eating, and most people's eyebrows go up. And I say it has to be that way because that's when the rubber meets the road. If you use your bad bite to eat, you'll never get better. That has to go away. So they know right up front. Well, I kind of kid with them. I say, well, if you have a girlfriend or whatever, you need a new girlfriend or a new boyfriend if they don't like it, because it has to stay in your mouth. Now, a lot of people will say, well, it hurts to chew on my teeth. Once you have an orthotic in your mouth, that's your bodyguard. It's putting you in the right place. It's putting your muscles in the right place. It's not allowing bad things to happen. So I really could care less what you eat once the orthotic is in. I just make a joke and say, you can eat nails. I don't really care what you eat, because you can't hurt yourself. Your jaw's not going anywhere. It's in the right place that we've measured. Now, as we're measuring and as you go through this journey that we talked about, those muscles change. They're changing because they're getting really functional. It's not an instantaneous change. It takes time. And as they change, your bite changes. And as your bite changes, we have to adjust for the change. And that's why you come in like once a month, so we can see what's going on, see how your posture is doing, see how your bite is doing. Because all along this journey, we're with you. It's never you against TMJ. It's always we're with you. All you need to do is call us. We've seen a lot in the last 24 years at the TMJ Center.
And that first session is complimentary. It's
the consult cure. I would rather a person do that, actually, unless they know about us or are referred or whatever. The consult cure is great because they get a feel for us and we'll understand where they're coming from. And quite frankly, is this the right thing you want to do?
And you're direct. You're like, this takes a commitment.
You've got to commit, because you don't. If you ask me to help you and get rid of what's bothering you, why would you not do what I'm trying to tell you to do? Because that kind of ties me up. If you're going to tie me up, then I'd rather you not come. And I say that in a nice way, but it's the truth.
Do you think some of that is built in because it is more of a quick fix thing? Oh, I've got a this or that. Here, take this pill. Get this neck injection. Get that. Of course,
that's what it is. And people don't realize. Well, maybe they do. I don't know. I'm not going to say that. Muscle, your body doesn't respond like that. Even a child, although a child will go fairly quickly. I mean, and will clean up real quick. My son was a good example, but we had to monitor him through years. But at some point, when again, a segue with my son, by the time he was 10 and his baby teeth came out, his permanent teeth came in straight, because we intercepted him at age 6, and we optimized his posture, we optimized his bite, we optimized his arches. The arches are what hold your teeth, and we got them the right width so that the teeth would come in straight. Now, it doesn't always happen, but a lot of times it will. So braces aren't what we need at that point. We need to be able to make sure that the person's growing right. That's one of my passions at this point, is working with kids. I just had my granddaughter at the office. I might as well use her. And she's a real cutie, but my son called me up and said, "Dad, can you see Eve?" And they're in New York. And I said, "Yeah, I can see what's going on." And he said, "Well, she's got face pain and neck pain, and she's only 10, and she's crying. And we went to the neurologist, and they want to prescribe some stuff." He said, "And I know, from our family." And I said, "You're right." I said, "Let me take a picture and send it." And there was a retrusion of the jaw, which means to me, at this point, it looked like the jaw could be too far back. And then I asked his wife, I said, "Why don't you put Eve against the wall and take a picture of her facing the wall? I want to see what shoulder's higher." And she goes, "She doesn't have a shoulder higher." I said, "She has to have a shoulder higher." And so then I got the picture back with this enormous left shoulder higher and an OMG from the wife saying, "Oh my God, I didn't know this." Anyway, we're treating Eve here, and they just left. And there are no more symptoms with this stuff because the jaw's in the right place. And I put her right on the computer. I put 6-year-olds on this computer. When we put anyone on a computer, it looks pretty sophisticated, which it is, but there's no pain. We're only taking information from muscle. We're not putting anything into muscle. We're just deriving information as the muscle goes through its paces. And we know what normal muscle should look like. And that's exactly what we're doing. So now my little granddaughter has no pain. She's doing great. She's incredible gymnastics person, and they just left, and it's kind of quiet now.
You got your house back. Yeah. My favorite treatment is the one where I'm in the dark room and get to take a nap.
What? The dark room. In between, we do our scans, and the first set of scans prove how dysfunctional, that's why I make a joke of that, prove how dysfunctional the patient really is, or how you really are, because the muscle, I know what to expect from normal muscle, and it certainly isn't normal. The other thing about this, and I'll digress into quickly about this, when we talk about genetics, I had a lady that we're treating for TMJ, and she wanted her son to come in, and her son was playing football. He's about 15, 16 years old, about 220-pound kid. I said, why are you bringing him in? And she said he can't stop clearing his throat. And I know something's wrong because she had TMJ, and we were talking about TMJ being in families. So the guy comes in, a big, strong kid. I said, so why are you here? And he goes, I said, what's going on? He says, I can't stop clearing my throat. There's something caught in the throat. I know it's caught in the throat. It's the hyoid bone because the muscles are dysfunctioning. And that hyoid bone is going to be very high up against the mandible. And so anyway, I said, well, let's get him on the computer. Let's go check. And the mom knows what to look for because, she was very good with this. So she's got her head over my right shoulder, and I had the kid on the computer, and I asked him to clench. And the masseters, which are arguably the strongest, densest muscle we talked about, should go off the charts with power. He clenched. The masseters flatlined. There was no power. And the temporalis muscle is trying to overcome that. Of course, there's a whole big muscle problem because temporalis can't do what a masseter does. So, and the tongue has got a swallow problem, and the hyoid and all the 20 muscles that attach the hyoid bone to the jaw and into the chest have a problem as well. So this kid's got a forward head. But he's a big, strong football player. I'll tell you what, when he's got an orthotic, which he knows because the orthotic was made and he didn't have that problem anymore. Oh, but my first question to him was, can you swallow a pill? And he said no. Because he couldn't swallow. 15-year-old kid couldn't swallow a pill because his hyoid bone is going crazy. So, and that's why it was a flat line. So, mom said a few things, but basically we had to put his jaw in the right place and then put his teeth in the right place when all was said and done, which we did, and he's been fine. But the kicker about the orthotic, if I might tell you that, is it optimizes and maximizes muscle recruitment power. But it's not just in your jaw. It goes into your neck, shoulders, back, and ribs like we talked about. And my son is one of those because he was an Olympic weightlifter in college. He wouldn't weightlift without an orthotic because it made him stronger. And you put an orthotic in, it will make you stronger because we optimize the muscle position. Yeah.
Wow, that's cool.
No question. I mean, that's a fact.
That is awesome.
Yeah, and I can prove it. Again, I can prove it on the computer.
Well, I'll tell you this with the orthotic, you start to feel weird without it in. As long as very good perception. Exactly. People feel like hollow because where's my jaw supposed to go? I don't have what I need for support, and that's when you know they're wearing it all the time. And you can actually feel like last week when I was in, I was talking about how when I've got my new one, I can almost feel my jaw slide a little bit into place, and then that was gone.
Yeah,
after
it's not used to it.
A few months.
It takes a while.
Yeah,
it takes a little bit.
And so I could tell that it was grown.
It's all about. I'm telling you, it's a journey, and it's not a rose garden. There are little bumps in the road, but the point is, what is your perception? What do you want out of this? If you want to be cured, then you'll go through this, and it's not painful. It's just. You just have to be. It
really isn't.
You got to be consistent.
You're already in pain, so it's not more painful.
Right.
You're literally you're reducing the pain as you go through the process.
Yeah.
So if people are having the symptoms of biting their lip, biting the inside of their cheek, jaw pain, head, neck, shoulder pain, snoring, trouble breathing, airway, those are kind of some of the initial symptoms.
Yeah, because the head comes, and it's all because the head's forward. But the head doesn't come forward unless the jaw is dysfunctioning. So you just work backwards. And again, you could say, well, how do you know these things? Because when I have a TMJ patient in my office, one of the questions I'll ask is, do you have any children? And if they do, I'd say, why don't you bring them in? Let's take a quick look. It doesn't cost a dime. and I'll just show you what I see, because obviously you don't want your kids to have the same problem.
Right.
So we'll take a look. And that's how we can diagnose and intercept a lot of times, so these kids don't have these problems anymore. So we get to optimize the child to grow properly. That's the whole idea. That's it in a nutshell.
So step one is a little bit of a self-analysis and seeing you have the symptoms. And then the next step is contacting Dr. Insulara and the crew at the TMJ and Sleep Center and getting yourself that free consultation.
Yeah, it would be good. And again, it's not just the jaw. But if you have clicking and popping, would that indicate TMJ? It indicates there's a problem, yes. And then we can check that out for you. So that is something you don't have to have clicking and popping to have TMJ. Okay.
Absolutely. Yeah, I did not.
Yeah, and TMJ is basically an anatomical site. It's the temporomandibular joint, so it's an anatomical site. But the you can say TMJ or TMJ dysfunction.
Yeah, I'm going to stick with TMJ because I'll just mess that up.
Yeah, no, just yeah. So those are common things.
In the next episode of the podcast, we're going to talk about the next step of the journey, which is now you've come in for your complimentary consultation. We've figured out that there's issues that need to be addressed. And the next step is?
The next step is, well, we do after an exam, okay, is we show you exactly. Now we're dealing with, we're not just dealing with opinion, we're dealing with fact. So now from the facts we deal from the exam, we will propose a treatment plan. And from that treatment plan, and it's all written out, codes, everything you need, it's all written out so that you see exactly what's going on. And basically, if we follow a scenario, which shouldn't change unless, I don't know, and it shouldn't change, and it works very well. But everybody's a little different. We can tailor it to different people, and particularly when you get teenagers that come in, they can't open their mouths and have problems with their headaches and neck pain and stuff like that. So it's all tailored, and that's what we've been doing for,
So the exam and creating
forever.
the treatment are the next couple of steps in the journey, and we're going to cover those in the next episode of the podcast.
And are you up for it?
And that is the big thing.
Yeah.
Dr. Insulara, thank you very much.
Thank you. Appreciate it.